What if belief could alter reality, particularly your physical health? Sounds intriguing, right? Well, it's not as far-fetched as it might seem. This is the realm of the placebo effect, an extraordinary phenomenon where our bodies respond to treatments that don't contain any active ingredients. It's a significant part of medical research and treatment, and it's not just about sugar pills. The placebo effect is about the power of belief, the mind-body connection, and the inherent mystery of human health. Join us as we delve into the fascinating world of the placebo effect. The placebo effect is a phenomenon that has puzzled scientists for decades. At its core, the placebo effect is about our body's reaction to the belief that we're receiving treatment. It's like a mental magic trick where the mind is convinced that a sugar pill or a saline injection is a potent remedy, leading to actual physical changes. The basic principle behind the placebo effect is the power of expectation. When we strongly believe that a treatment will work, our bodies often respond as if it's true. This is why placebos, treatments that have no therapeutic value, are used in research. Imagine a scenario where two groups of participants are given pills to treat a condition. One group receives the actual medicine, while the other gets a placebo, often a sugar pill that looks identical to the real thing. Neither the participants nor the researchers know who received what, a method known as double-blind testing. This helps to eliminate bias and determine if the actual medicine works better than the belief in it. Despite its widespread use, understanding how the placebo effect works is a complex task. It's a journey into the mind-body connection, unraveling the intricate ways our thoughts, beliefs, and expectations can shape our physical health. But one thing is clear: the placebo effect showcases the extraordinary power of belief and the potential of our own minds to influence our bodies. The placebo effect is not just a trick of the mind. It involves real, tangible changes in the body. Let's delve deeper into the mechanisms that make this possible. First, let's talk about the psychological aspect. The placebo effect hinges on the power of expectation. When we anticipate a positive outcome, our brain releases chemicals that can actually alleviate symptoms. This is why a patient who believes they are receiving a potent medication can experience relief, even if they're only receiving a sugar pill. But the placebo effect is not entirely psychological. It also has a physiological side. When we expect to feel better, our brain can trigger the release of endorphins, natural painkillers produced in response to stress or discomfort. This is one of the reasons why a placebo can reduce pain. The brain plays a central role in the placebo effect. Neuroimaging studies have shown that placebos can activate specific regions of the brain associated with pain relief and mood enhancement. In other words, the placebo effect can cause actual changes in brain activity. Moreover, the placebo effect can influence the autonomic nervous system, which controls unconscious processes like heart rate and digestion. This is why placebos can have an impact on conditions such as heart disease and irritable bowel syndrome. So the placebo effect is indeed a testament to the power of belief. It shows us how our mindset can have a profound impact on our physical well-being. Placebos have a crucial role in the world of medicine, especially in the testing of new treatments. You see, when a potential new drug is developed, it's not enough to just see if it works. It must be compared to a placebo, a substance with no therapeutic effect. This comparison helps researchers determine if the drug's benefits are real or if they're simply the result of a person's belief that they're getting treatment. It's like running a race against a stationary runner to truly measure your speed. Now, while this method is invaluable in confirming a new drug's efficacy, it does raise some ethical questions. Is it right to give a patient a placebo, essentially a nothing pill, when they believe they're receiving a potential cure? This balancing act between scientific necessity and ethical responsibility is a constant challenge in the realm of medicine. The use of placebos is a vital part of scientific research, but it's not without its ethical dilemmas. The placebo effect is not just a laboratory phenomenon, it's happening all around us. Let's explore some real-world examples that demonstrate the placebo effect in action. One compelling case comes from the realm of pain management. A war surgeon during World War II, Henry K. Beecher, ran out of morphine to ease the pain of wounded soldiers. In desperation, he injected saline instead, telling them it was a powerful painkiller. Miraculously, the soldiers reported relief, a prime example of the placebo effect. Then there's the facet of mental health. A study published in the Journal of the American Medical Association showcased the power of placebos in treating depression. Patients who knowingly took sugar pills, a practice known as open-label placebo, reported significant improvements in their mood. Their belief in the process was so strong it triggered a genuine therapeutic response. Another instance comes from a group of hotel maids who were told that their daily work met the recommended exercise guidelines. Even though their actual activity level did not change, these maids experienced reductions in weight, blood pressure, and body fat, simply because they believed they were exercising enough. Finally, let's look at the nocebo effect. Patients warned about the side effects of a medication often experience them, even when given a placebo. This phenomenon underlines the power of negative expectations and how they can influence our health. These examples show us how powerful and pervasive the placebo effect can be. Harnessing the placebo effect in a clinical setting is no easy task. The first hurdle is the ethical implications. It's a delicate balance, using a treatment that could potentially have no physical effect, yet could produce a psychological response. Then there's the issue of individual variability. The placebo effect doesn't work for everyone, and it's not always clear why it works for some and not for others. This presents a significant challenge in standardizing treatment protocols. Despite these obstacles, the opportunities are too compelling to ignore. The placebo effect has the potential to revolutionize treatment approaches, especially for conditions like chronic pain and mental health disorders. It could lead to a new era of personalized medicine, where the focus is not just on the physical, but also the psychological aspects of healing. Despite the challenges, the placebo effect holds exciting potential for the future of medicine. While the placebo effect can be beneficial, it also raises important ethical questions. One key concern is the deception often involved in giving a patient a placebo without their knowledge. This can undermine trust and breach the principle of informed consent. On the other hand, if a placebo can improve a patient's health with no side effects, is it not ethical to use it? These dilemmas underscore the complexity of placebo use in research and therapy. The ethical use of placebos is a topic that continues to spark debate among professionals. The placebo effect is more than just all in the mind. It's a fascinating interaction between mind and body. This journey we've embarked on together has allowed us to delve into the depths of this intriguing phenomenon, exploring its many facets, from its definition to its profound impact on clinical trials. We've learned that the placebo effect is built on the basic principle of belief influencing physical outcomes. It's a cornerstone of research, validating the efficacy of new medical treatments and challenging our understanding of what constitutes effective therapy. We've discovered the psychological and physiological mechanisms that drive this effect, with expectations and brain activity playing pivotal roles. We've seen it in action, with real-world examples from pain management to mental health, and even the surprising success of open-label placebos. The challenges and opportunities that the placebo effect presents have been laid bare, showcasing the potential benefits and the future of placebo research. And we've grappled with the ethical implications of using placebos in research and therapy, a topic that invites much debate and contemplation. Now we invite you to consider how the placebo effect might play a role in your own life. How many times have you experienced relief from a sugar pill, or felt better after a doctor's reassuring words? We hope this peek into the placebo effect has sparked your curiosity. Share your thoughts or experiences with us in the comments below.